Hello everyone, I am Dr. Chinnababu Sunkavalli. I am a robotic surgical oncologist practicing in Hyderabad. Today we will be talking about how long will the cancer patients survive. Usually the minute you hear about cancer diagnosis, the next question that comes to your mind, how long will I be cured if the disease is going to come back and what is my outcome? So you might want to know whether it can be cured or not and what is the outcomes in terms of the number of years that you're going to live. So it is more like people might say, a sentence that is given to them. So cancer survival rates or the overall survival rate is basically, it's a percentage of people who survive a certain type of cancer for a specific amount of time. Usually in cancer, we talk about 5-year overall survival. So the percentage of people with a particular type of cancer who survive for 5 years, whether on treatment or if they're off the disease, we do not know. But number of people who are disease free or with disease but for 5 years at least is what we call as 5-year overall survival rate. So the survival depends on various factors. The survival includes the type of the cancer one has, the genetic component it has got, and it also depends on the time at which the treatment has begun and the stage in which the diagnosis has been made, and how well the type of treatment is responding to particular therapy also determines the survival. Similarly, how much it has spread to other parts would also determine the outcomes of the survival. So every person is unique and the outcomes are different for each person as the cancer is different in every person. But however, the survival rates are in general based on the experience of the people with similar tumors in other people. That's what usually prediction of the future, and it's relatively easy or more difficult to sometimes cure or to define. But however, you can't exactly predict. So keep in mind the survival rates are not very specific for your tumor. This is the general prediction of the people's experience of same cancer, same stage, how they have fared. So the other question that you may want to know or the answer is basically, what can't survival rates tell you? The cancer survival rates can't tell you exactly how you are going to behave. So in your particular case, your histology, the type of the tumor, the mutation that you have can be different, and it can be different in terms of the outcomes for you. So it is only for a general prediction of the future, and it is not your individual chance of cure or remission cannot be told, but the overall trend can be predicted with the survival rate. So for this reason, some people ignore cancer survival rates, because even if you say 90% is survival rate and if you fall in the 10%, which people, the disease comes back and they don't make it to 5 years, then for you it is 100%, the outcomes are poor. So given that, you may choose to ignore the survival rates if you want to, but I think one thing that can give you peace of mind is to be aware of probability of you getting a better outcomes and how long people of similar disease have lived and have faced this disease. I think that is something which is going to give you some kind of a comfort, but you have a choice to even not to really look at the survival rates, because sometimes it can be frightening, sometimes it is confusing to know these numbers and they may not really make much of sense for you. It may also cause anxiety, and your options of analyzing sometimes before your treatment can be difficult. So given that, you choose what you want to know, and too much information is not good when you are diagnosed with cancer. So cancer survival rates are important. That will give you hope as well. At the same time, too much of data and statistics won't help you much, because they may confuse you and they may actually frighten you. Thank you so much for watching this video.